I'm a passionate physician who always took cancer under my wings and to make a difference in the world. For 30 years of my career, I was at the world's largest medical center and the world's #1 cancer institute today, which is the MD Anderson Cancer Center. My deep relationships and working in close association with one of the renowned cancer specialists across the world, my passion over the years grew for this disease from the standpoint of not just searching for a cure at the end of the day, but see what we can do to prevent. And particularly in our country, knowing the statistics which are very alarming, 1.2 billion people in the world will be at risk for cancer in the coming years, out of which 1 in every 8 Indians will be at risk for cancer. So the problem is gigantic. This cannot be just simply be ignored. I think summits of this nature will bring in people from different corners of the world to deliberate, to discuss, to present, to lay down a new path for developing nations and also the developed nations. But we in India, with our growing problem, our scarcity of health resources, the rising cancer incidence, what is that we can do at the end of the day? I think meetings of this nature will help us to explore, how we can really, given our current constraints in terms of resources, take this to a massive scale in terms of, prevention, strategy, and education. 800 million people living in the rural areas of the country till today. Diseases like breast cancer, which are absolutely submerged. We have not even reached the tip of the iceberg, and they're dying out of social stigma, dying out of ignorance. So we have a tremendous opportunity to choose something which has not yet ever been chosen in the world, and be the pioneers. How on a massive scale we can intervene and apply a tool that we can bring these patients to the fore and see how best we can do. Treatment is the easiest part. For us to go to medical schools, practice day in and day out, doing surgery, taking a machine and preventing radiation treatment, or taking the drugs that have been invented and giving the patient chemotherapy is the most easiest part, because this is purely on the basis of science, and good doctors, emulate science. But that's not what we're discussing about. What we're discussing about is that how to unravel, these submerged populations who are besieged with cancer, were never brought to the fore. That should be the crux of this meeting. And while we are deliberating on these things, as Dr. Subbarao Garu mentioned very eloquently, many paradigm shifts are happening in approach to cancer. Now, these paradigm shifts are happening right from the stage of diagnosis to the stage of intervention, treatment, and then subsequent follow-up. Molecular diagnosis. A wide array of molecular diagnostic testings that are emerging at a very rapid pace. Then individual customized diagnostics, like as he said, a single cancer behavior, could be different from somebody else who had the cancer. So the behavioral difference in the cancers is responsible thus far for not optimally responding to an established conventional therapy, hence the failures. So while the world's scientific bodies and good institutes are addressing that particular issue, and an institute like MD Anderson happens to be in the forefront, where they've identified 10 cancers in a span of 10 years under the program called the Moonshot Program, where they're looking forward to finding a treatment and perhaps eradicate. It may not be very specific for this audience, but just to bring to your awareness, scientists across the world, they are making an attempt to find a cure for these cancers based upon the new, genomic DNA sequencing techniques and a lot of these things that are happening. So there is hope. There is hope now, tremendous hope by some of these new things that are coming on board. But one message from the lay public standpoint.